Okay, well, welcome. I'm grateful for.
Very late.
I know. I'll be brief. I have 8 minutes to explain 8 days of material, but we can do it. We can do it. So, just a brief background. My name is Stephen Sofel, and I am in the trenches with the companies that sponsor these health plans for employees. I know that there are some in this room that own businesses that spend millions of dollars a year and have very little understanding about what they can do to slow the cost curve and the growth that's taken place. So I'm going to speak for just a minute. We're in this space today of providing benefits. I'm going to talk for just a minute about how this law impacts small business. And Dr. Beher mentioned, he said, where are you going to get the money from? Well, there's two places, and the government is currently squeezing the insurance company to as far as they can. They're requiring loss ratios, which suggests that their profits are limited. And then once that's done, the only other place to get that money from are employers, because it's not going to come from the individuals, and it's not going to come from the government. The government's printing as much money as they can, and they're just going to basically develop tax revenues to make these programs work. So employers are really going to see the bulk of the financial impact, and as well as providers. I think most of the doctors that are in this room would probably agree that they get squeezed as well in this process. But just to talk about the complexity, we've done enough of that already, but we have a significant amount of additional information and regulations that will come forth from this law. 2,500 pages, and I believe the statistic was roughly 80% of the law was actually left for further development by Health and Human Resources, Treasury, and the IRS. And so even though it was an incredibly extensive law, much of what will end up being the final product is in development as we speak today. So a couple of things that I think are important to small business owners. If you're a small business owner, you need to know about the healthcare tax credit that you qualify for if you're a small business owner. And this is something that I believe was less than 20% of small businesses applied for this credit, even though it's been on the books since 2010. And so the education in this space, in fact, this is what a lot of the political dialogue was over the last election cycle, was that the education for this law has been very poor. Very poor, and it's incredibly complex, and so it was probably not the law to miss on when it comes to the education. So right now, if you are a small business with less than 25 employees, which just so happens is roughly 80% of all businesses in America fit into this category, are less than 25 full-time employees, you qualify for a healthcare tax credit for the premiums that you pay. Now, your average wages need to be under $50,000. Tax credits of up to 35% of the premiums. If you have questions about this, I'd be happy through Sanjay and IAPAC to answer any questions by email, but we need to educate small business owners of this credit, because it's not a deduction. It doesn't just limit the amount of taxes you owe. It's a credit against the taxes that you owe the government. And if you're a nonprofit, so you don't claim any income taxes, you can actually still get a refund on this credit. And if you are a business that is for profit but just don't have any income that would support a refund, you can carry this credit into future years. And you can go back. So if you didn't do it last year, there's still time to capture that. So you need to know about that. Health insurance exchanges, I won't spend much time on that because it's been covered. Ending of price discrimination is important for small businesses, because in Texas, if you have 30 employees today, your carrier can rate you up 67% in 1 year. So if your premiums are $100,000 a year and one of your employees develop cancer, then you're likely to see a significant increase to your premiums the following year. It could be by the restriction of 67%. It could be as high as 2/3 again. So 100,000 could turn into, as mentioned, $167,000 a premium for 1 year. So most small businesses cannot afford to deal with that type of a premium increase. So that ending of price discrimination is a positive, except as Dr. pointed out, that the ones who are healthy today are actually going to have to pay for the benefit that the unhealthy groups are going to be receiving by eliminating price discrimination, because again, there's no free lunch here. So the incentivize, number 4, incentivize workers to look at small businesses. Today, if you are ill and you're an employee, you would likely not take the risk of going to work for a small business because of the disability in their insurance programs. So ExxonMobil has a very stable insurance program, completely self-funded. The interest that they make on their health insurance trust pays for a large portion of the claims that they have every year. Small businesses don't have the luxury. So you would likely stay at ExxonMobil if your child develops a MS or some sort of significant illness because of the security of knowing you have a good benefits program. The Affordable Care Act was designed to try to bridge that gap somewhat and allow small businesses to have stable and productive benefits programs. And so from that perspective, there will be, as a small business owner, the ability to track more talented professionals if you no longer have to pay an excessive premium based on medical conditions. And so there's positive benefits to small business owners attracting talent that would likely stay with large employers, reduce premiums. And again, if you go to the White House website, you'll see statements like substantially reduced premiums. And when you look into the numbers, they project out a 1% decrease over the years 2016. So not what I would consider substantial. So I wouldn't suggest anybody make plans for that excess money that they think they're going to have with the reduction of premiums for healthcare reform. As Dr. just pointed out, our original projections also suggests that there's very little impact at the end of the day. There's just a shifting of where the money is coming from and where it's going, but ultimately very little impact to the employer on their expectations of premiums that they'll be paying going forward. Other studies obviously suggest costs will rise, and then the Affordable Care Act is designed to remove the cost of the uninsured, and this is what Mimi spoke of earlier on in the original presentation, that the cost burden of individuals who are ill and don't have insurance to help pay for that falls upon the balance of the population that actually covers various insurance. And so depending on which side you're on in that equation, you could be hurt or helped by this payer play. The doctor just mentioned this in somewhat of a different angle, but there is a fine imposed by the government on individuals who no longer carry health insurance. The fine is so small, we feel that it will make very little impact in forcing people. In other words, if your insurance costs you $4,000 per year, but you have to pay a $95 per year fine, which is the first year of the fine, that's very little incentive to buy the insurance, right, but pay the fine. Where does the cost burden that's generated from opting out and paying the fine fall back on? Again, like I say, fall back to the government, by extension to the employers who are really ultimately funding health insurance benefits for the population. And so the fines do increase over time, but again, if you have low income and you have and you can support the credits that you receive from the government, the fine is very small. I think I'm done. So this is a very complex topic, and I apologize for talking so fast, but I'm grateful for the opportunity to be here. Thank you.